Good afternoon. This is Howard Sorkin with DePaul University's Capstone Case Study course, and we are going to go over Chapter 6 of the textbook, which is on health insurance planning. And you're picking this up in the archives. And let's focus in on the fact that health insurance is a very, very important part of people's financial plan, because without having insurance, people can go bankrupt because of the high cost of medical care. And many times as a financial planner, you're going to be asked to review people's health insurance as a risk management tool to see that they have the proper amount, especially as you're dealing either with young families, people that are going to have children, or as they retire, you have to be aware of Medicare and what the alternatives are. You're also going to be confronted with situations where people are going to come to you about COBRA and the Affordable Care Act. While not in the textbook right now, I am going to give you some other highlights, and I encourage you to keep up to date with this. The slide analyzed the situation just like any other financial planning or insurance planning, investment planning item. You have to figure out what the goals and objectives are, and you have to start and analyze. You're going to use the same six steps of analyzing health insurance as you would use for analyzing financial planning, investment planning, where you start with the information, you establish the relationship, you gather, you go to step 2, which is gathering the data. What are we trying to accomplish? And when you go to gather the data, you also need to find out regarding health situations and dependent care situations, seeing whether or not people have special need situations. This is all part of the client data information gathering situation. Once you determine that, step 3 would be to quantify what their needs are. And remember, under the Affordable Care Act, the pre-existing conditions doesn't matter, and there's certain things that no longer matter, but you still need to be aware of them so that you make sure you give people the correct information. Family history, as it says here, is an important factor, especially for young families. You have to find out if there's any kind of genetic issues. You should find out if there's any other special items. People do have the right to opt out of group insurance plans, especially if you have 2-income households, where one of in many cases, the mom and dad might each be under their own plan at work because they can get it for free. Now, a lot of things we're talking about are going to change under the Affordable Care Act, and I'm going to cover that at the end of these slides because I don't know the situation. No one really knows the situation because it's been changing forever. January 1st, certain things were supposed to go into effect, and then it was extended, and the penalties for not having insurance under the Affordable Care Act will kick in at the end of March. And I'm going to give you the information I have right now, but I encourage you to participate in educational programs and stay current, because as a financial planner, it's going to be very important that you do know what's going on, because people are going to rely on you. So 2-income households, consider whether or not having one as the primary carrier, having both mom and dad on their own because it may be more cost effective, having the children on one of them, whichever is better, and understand that opting out is not a consideration if you don't have any other coverage. If you do, then you may want to opt out because you can always opt back in because you're not going to have and pay for 2 different plans. In red letters it says, if both parents provide family coverage, and the parent whose birthday comes first in the year is the primary provider. That's probably in red because it might be some kind of a test question. In the introductory course, we talked about COBRA insurance, and it says that COBRA is offered to people who work for companies with more than 20 full-time employees or some combination thereof, and that the COBRA is the standard COBRA benefit is for 18 months, and that can be extended to 29 months or 11 months extra if the triggering event is being disabled. It's extended to 36 months in the event of the death of the employee, divorce, special needs situation where you have a child that's already on coverage and is dependent over the age of now 26, and if you're getting close to Medicare, it would be 36 months. And further says that the employer may charge 102% of the full unsubsidized premium they're being charged. And many times people with COBRA coverage think that their former employer is cheating them because they're charging such a high premium when they were only paying $50 a week, which was because it was subsidized. Retirees, you must understand that retirees are eligible for Medicare. Medicare is a separate tax, and when you think about taxes today, there's success tax. If your income is over $420,000, there's going to be extra taxes to be paid if you're a married couple for Medicare. Medicare is available at age 65, so if you retire before age 65, Medicare is not a factor. Medicare Part A is automatically included as at age 65. Part B you pay extra for, but it's deducted from your Medicare health plan, is that from your Social Security premium. Medicare Part C is what a lot of people want, which is like an HMO for Medicare, called Medicare Advantage. Medicare Part D is for drug coverage. Typically, Medicare insurance plans don't offer drug coverage unless you're in the hospital. If you're self-employed, you may be, under the old laws, you may have some other restrictions for health insurance. Under the Obamacare, you may be required to take it through the health exchange, which is an advantage, except the costs are going to be a lot higher than people indicated. These are just some different kinds of charts that are in your textbook also, and it talks about traditional plans and PPOs, or preferred provider plans, which have selected certain providers in hospitals to reduce the costs. Point of service plans, which operate as a cross between a PPO and an HMO. The HMO is the health maintenance organization, and how all of these plans work. Again, this was covered in the first session, first course, and it's also in your textbook. And be aware of how you have the choices, what kind of coverage you have, what benefits are available, and what other provisions might be available. Medicare planning, again, I've already sort of discussed this, Part A, Part B, Part D, and then the important part for Medicare Part A is it's covering hospital coverage, and it also covers hospice care for terminally ill. And it does include in hospital some pints of blood if it's at a hospital or skilled nursing facility. Medicare Part B is more of a doctor's plan, an out-of-hospital plan, but it's really going to be paying for necessities and certain therapies. Some people think Medicare is the greatest thing they ever had. Other people don't like it. But Medicare Part A plus Medicare Part B is where people should have at a bare minimum. Medicare Part C is Medicare Advantage or Choice, which is more like an HMO. Medicare Part D is very controversial. That is the drug coverage. You really need to go online and advise your clients that they can go to certain websites and see what is the best plan for them based upon the drugs they're currently taking or need to take. And clients are paying separate premiums for Medicare Part D. The other thing about Medicare insurance is what's called Medigap or Medicare Supplement Plan. These are structured so that all insurance companies that offer them will offer the same benefits for the C plan, the F plan, and so forth. They get to charge what they feel is the appropriate cost or premium for that for the people over the age of 65. And when you have Medicare Part A and Part B and maybe C or D with Medigap insurance, you have the full gamut of insurance. This is a chart that shows what's covered. Again, this is in your textbook. I'm not promoting any insurance company, but you can go online to Blue Cross for Medicare, and you'll see a chart like this, which gives you a little more detail if that's what you want. Again, this is just an overview. This is not designed to give you everything you need to know. You do need to understand that on the comprehensive exam, they're going to ask you to do some claim examples. And some claim examples are If you both, it's probably going to be for individual health insurance or for PPO or maybe appointed service plan, and they're going to want to see if you know when the deductible is paid, which is usually first, and then what is the co-insurance percentage, what is the maximum out-of-pocket cost, what is the doctor's office copay. These are all terms that you need to be aware of. And some of the terms here are on this slide slide 23, current deductible, co-payment, co-insurance, stop-loss limit. And again, you can refer to all of this in the textbook. If you have any other questions, you can always email them in. I went over great detail in the first class, the fundamentals class, on health insurance. If you have more than one employer health insurance plan, because the couple might have more than one plan between the husband and wife, one becomes the primary, one becomes the secondary, because insurance is designed to indemnify you for losses. It's not designed so that you can benefit financially. Please make sure you review all of the information. And I also tell everybody, check your health insurance card, regardless who it's from, and make sure you call the 800 number to get certified and pre-certified so you don't have money out of pocket. Going back to Medicare, speaking of being careful, it's been on the news lately that you don't want to be admitted to a hospital under Medicare for observation, because then Medicare may not pay what they would pay if you were admitted for a reason. So be careful how that works. Choosing your health plan, keep in mind that sometimes you have limited plans offered by employers. We still don't know how that's going to change under the new Affordable Care Act. Be aware of the fact that in addition, under the Patient Protection Act, also called the Affordable Care Act, possibly referred to as Obamacare or PPACA or the ACA plan. These are some highlights on the plan, and this is available online again and in the textbook. When did the plans come into being? In 2010, the law started saying that adult children to age 26 would be covered under mom and dad's plan. It used to be only to age 19 or 22 if you're a full-time student. And these are some of the changes that are available. I'm going to refer to some notes I have on the Affordable Care Act. You can go to www.healthcare.gov, and get the most current information. There's a lot of controversy whether you should even be going and looking at the information online and registering, because maybe the websites are not as secure as people had hoped for. In 2014, the maximum lifetime benefit limits are gone. At that point, everything has to be open, so you can't run out of benefits. They talked about the fact that 15% of 40 million Americans had no health insurance prior to this law going into effect, and the purpose of this law is to provide everybody with coverage. Depending on your income and how low it is, you may be eligible, or your people may be eligible for subsidies for health insurance, and that subsidy means that you're down to about 138% of what the federal government classifies as the poverty level, and if you're below that number, you're eligible for some subsidy. You're going to have an ID card to show that you have coverage. Every American citizen is going to have coverage, and it's going to prohibit insurance companies from denying coverage due to pre-existing conditions. Again, prohibits lifetime maximum benefits. Prohibits the insurance companies from rescinding a contract once it's been entered into, unless the insurance company can prove that you tried to perpetrate a fraud. It does establish federal subsidies for people at low income levels so that they can get insurance. It is expanding what is going to be available under Medicaid. It requires employers with more than 50 employees to cover health insurance or pay a fine. It's going to require that Health insurance companies provide for immunization of children and cancer screening for women. Some of the stuff wasn't required before. It's going to require preventive care even under Medicare and Medicaid. And for newborns, it's going to broaden what's covered under mental health benefits. And there are 10 essential care kinds of coverage that must be included. In 2018, it's going to expand a 40% excise tax on what's called a Cadillac plan. So if your total premium is over $10,000, $10,200 I think it is, you are then going to be taxed 40% of the difference between $10,200 and $27,000 or $30,000, and that's going to be taxed, and you're going to have to pay it under ordinary income tax. We're going to be expanding what's called the health savings accounts and the use of them. But who's going to pay for all of this? Everyone's talking about how great the benefit is. Who's going to pay? Well, there's going to be higher deductibles, higher out-of-pocket maximums, and in some cases, some insurance companies are not going to continue to provide coverage, and you might be going to the governmental exchange. I've read that there are going to be 19 new taxes, and that tax would be up to, and what you're going to be paying is up to 9.5% on your adjusted gross income. It's going to expand coverage for Medicare and Medicaid, but it's also going to increase the taxes. There's going to be a special tax on tanning beds and tanning salons of up to 10%. Restaurants and foods sold from vending machines will require nutritional labels. That actually was on the news this week. Companies are going to be fined $4,000 per person, or and up to $2,000 for an employee. The IRS has the right to levy liens against your accounts. They also have the right to suspend your driver's license if you don't have insurance. So again, this is just an overview on health insurance. Please make sure you understand the concepts. Please review how to do a claim example. When you're doing your comprehensive group case, it's also important that you do pay attention to health insurance and what the Harrises should be doing as part of their retirement plan. So this was an overview of Chapter 6. I am going to turn off the recording, and thank you very much.